Hello, this is Tyler White with Survivopedia. I'm talking to you today about the Survival MD book, What to Do When There Is No Doctor. One of the things that I want to cover is on page 121. On this page, they have the top 5 injuries during a crisis: lacerations, abrasions, puncture wounds, burns, fractures, and then type of injuries that you'll find, and then it kind of goes into depths: new wounds, old wounds, and so forth. So when I used to be an EMT, we had this thing called the mechanism of injury. The mechanism of injury is basically what caused the damage. Now, as an EMT, the majority of the damage is caused by some kind of a car accident, right? So the mechanism of injury for whiplash is the car accident, which means if I visualize that my head is snapping forward and snapping back, that should give me the ability to have a little bit of logical deduction and say, well, that's going to rip some muscles in the back. It might give me a concussion in the back of the head. So I know where to check. I want to check the back of the head. I want to make sure the skull's not broken. Work from top to bottom. Now, when I was in military medical training, we did it the polar opposite because the mechanism of injury was different. We would start with the feet and the hands and work our way up. It sounds backwards, but the reality is, as a soldier, if you went down, you probably took a round in an extremity, maybe in the chest, possibly you probably stepped on something, broke something, sprained an ankle, and so forth. So you're more likely to find the injury faster if you know what the mechanism of injury was or the cause. Once you've done that, you can use some common sense and some logical deduction to figure out how do we stop the bleeding, how do we work on the airway, breathing, circulatory, or the march algorithm. So when it comes to the book, he talks initially about lacerations. They can occur with building things like an outhouse or debris from a disaster like a tornado, flood, or tsunami. If you wear gloves during building cleanup in a disaster, you can avoid many lacerations. One of the things that he suggests is proper prior planning. When it comes to proper prior planning, if I can say that, having armored equipment like gloves, jacket, glasses, those type of things will prevent the injury from happening to begin with. But if you don't have those things, because you can't always be completely prepared, understanding what caused the injury can help you to identify it and to correct or fix it. The problem with lacerations specifically is they rip and they tear. Like the difference between being cut with a saw or being cut with a knife. When it comes to being cut with a saw, it's a much uglier and worse wound. Skin will attach to it when you pull bandages free. It just tears stuff. Being cut with a knife is bad, but it can seal up much easier. So lacerations are something you really need to watch out for. Also infections when it comes to lacerations. If you lacerated something, probably whipped you or scraped you or really tore something open, and you have all these little crevices and areas, one of the first things you're gonna wanna do is use sterile water to clean all of that out. Bandage it appropriately with some sort of an antimicrobial or non-bacterial growing stuff, neosporin type thing, and then wrap it until it heals. You may need to stock up on antibiotics and learn how they work so that you can counteract any of the stuff that might get inside of a laceration. When it comes to abrasions, it's anywhere from tripping and scraping your knee to road rash. The worse it is, well, the worse it is. Abrasions, you also need to be able to prepare by, again, just like lacerations, clean it out. Find something that has clean, preferably sterile, surgical grade water to clean it out, which means you're gonna have to stock up on this stuff. Once you clean it, some sort of a medication to keep stuff from growing, and then a wet or a antimicrobial, neosporin, Bactrin type of cover before you put it on the injury. If that injury grows together or meshes with the bandage, when it comes time to train that bandage, to switch the bandage out, you're going to take flesh with it. So make sure that it's damp with something that is sterile before you put it on any kind of an abrasion. If it's something substantial like road rash or even fire, make sure that you seek medical help as soon as possible, because the shock and the stuff that's going to build up from that can be very life-threatening. Puncture wounds are bad because they take foreign objects, maybe an ice pick, a knife or something, barbed wire, and they take the contaminants that's on that and they stick it deep inside the body. That's really dangerous. So when it comes to puncture wounds, first off, make sure you don't have internal bleeding. Use a tourniquet if necessary. If it's a little puncture wound like a sewing machine versus a large puncture wound like a knife, it'll be less detrimental, but you're always going to want to stop the bleed internally with any kind of a gauze. If it's big like a bullet, because a bullet is basically just a big puncture wound, you're going to need to get surgery to repair the damage on the inside. and some sort of a antimicrobial penicillin type of whatever that you can use to stop that foreign material that's been introduced inside of a puncture wound. So be careful to make sure they're clean, seal them up, if necessary, get surgical help. Burns. Burns come in all sizes. I have something that I really like for burns. In my medical kit, I've got a burn section. I like to use this stuff called Burn Free. You can use whatever stuff you want. I like to use Burn Free because it's worked for me in the past. Now you can have first degree, second degree, third degree, and really worse than that burns, right? So first degree is a sunburn, second degree is something with blisters, third degree the flesh is coming off or it's charred. You can get into gray areas when it comes from that second degree to first degree, because sometimes second degrees can be bad enough to make flesh come off. The key with the burn is to immediately stop the damage, because even though it's hot on the outside, that damage is still happening and still going deep inside, even after you've pulled off of the fire or the electrical device or whatever it was that burned you, especially when it comes to chemicals. If it's chemicals, you have to have some sort of agent that neutralizes that chemical and you clean it immediately. And you really need chemical knowledge to deal with chemicals, so try to stay away from that. When it comes to sunburns, this Burn Free comes in a little tube. You squirt that stuff all over, it's cool. Even this bag right here feels nice and cold, and it immediately pulls the cold out. You don't want to add anything like butter that keeps the heat in, that can actually exasperate the burn and make the burn worse. So in your med kits, get some sort of Burn Free, something that can deal with the sunburn you're inevitably going to have happen if you've been living in an office for decades and suddenly you're in an SHTF situation, you're farming, whatever, you're going to get sunburned. So make sure you get something to deal with that. The level 2 stuff with blisters, just like with the road rash, get the bandages wet before you put it on so it doesn't rip flesh off when you remove it. And proper prior planning. Get some sort of a burn-free type of aid that helps you. This is a face mask, so if you had something blow up in your face, you'd rip this open and stick the whole thing on your face. I can't quote the statistics, but it substantially decreases the damage, almost to the point that you can be completely repaired without having permanent physical impairment if you can immediately get to the burn with some sort of a burn-free related aid. Okay, fractures, I've had a few. Scars right there, scars there. When it comes to fractures, there's a dedicated section in the book that talks about all sorts of different kinds of fractures. One thing I suggest you purchase is a fracture fork. It's like a tuning fork that you can put on the end of the bone, and if there is a fracture, you'll feel the crepitus because it will cause that bone to vibrate, and it will vibrate against the crack, and it'll be extremely painful. If it's just a sprain, the fracture fork will cause the bone to vibrate and it'll feel like a tickle. So first off, we got to know, is it a fracture? So we go back to that old technology that predates the x-ray. We use the fracture fork. We do our best guesstimate if we don't have an actual x-ray machine, and then we stabilize the joint. When it comes to proper prior planning, if you use something like a SAM splint, which bends until it's put into a U shape, you can use this on just about anything. So what I mean by that is it will bend, and then when I put it into a U shape, it becomes rigid. No longer bends. And that's important because now I can shape it to whatever length of the broken bone is, and I can make it U-shaped. Now the only part of this SAM splint that's going to bend is at that joint. This part won't, and this part won't. It becomes hard when you make that U shape. So if I broke my forearm right here, radius and ulna, I would give myself something to grip, and I would put some sort of a t-shirt or a bandage and bandana or something above and below the fracture, right? So if I've got fractures right here, I'm going to stabilize it right here. And because it's kind of hard to get to this, I'm going to stabilize it right here. Another thing you can do for an arm specifically is put it in a sling, and then to keep it from flopping, you just put it all the way around the chest. This happened to me when I was a child. We were able to get me out of the Wind Rivers, and I was able to get surgery to fix what was otherwise a green tree limb fracture. So the takeaway for this, proper prior planning, have some sort of SAM splint or some sort of way to deal with it, even if that means purchasing some sort of casting material. And if you don't know or don't have the ability to do that, there's sticks all over the planet. Everyone's got t-shirts. Wrap something soft around the t-shirt, be it socks or underwear or sticks. Use those to stabilize above and below the break. Use the limb that's broken and stabilize it against the body. If you break a finger, stabilize it against another finger. Even if you break a leg, you can stabilize it against another leg. If you were lost at sea and you didn't have sticks, you've still got clothes. That's how you can use one to stabilize against the other if that's not an option. For more in-depth and other techniques, from head trauma to puncture wounds and infection to burns and bullet wounds, grab the book. It's called Survival MD, What to Do When There's No Doctor. And thank you for watching.